Dr. Lou, there's lots of information which we get from very young age about brushing and flossing and stuff like that. And for some reason, there is still some different opinions. Some say you brush like this, some you brush like that, some say you brush this way. We have soft brushes and hard brushes. We have electric brushes and hand. We have flosses which are lined with whatever plastic or whatever, like, saying. We have thick and thin one. Tell us a little bit, what is your opinion on some of the best practices which we should take care of to keep our teeth clean?
Well, generally, what I tell my patients is it's a whole. We like them to first floss. Then generally we like them to brush their teeth, and then generally like them to use mouth rinse. So it's a whole routine.
So flossing first, because I always brush first and floss afterwards.
Well, generally I like our patients to floss first, because the flossing will help take out all of the big, like if they have like food impaction or any of the plaque. So once you remove that, the brushing will help clean that area a little better. Instead of if they brush it and they still have some food stuck in it and then they floss it out, there's still maybe some plaque or some residual in there that wasn't removed when you're brushing.
Well, makes sense. So tonight I'll change. Okay.
Yes, and then after that you use the mouth rinse, which can kill the bacteria, whatever remaining bacteria that's around.
Okay. So how should we brush?
You know what? There's many people have different ways to brush, but the way that the ADA mentions is it's a 45-degree angle. Basically, you tilt it where it's covering your teeth and it's brushing some of your gum line, especially in the front. There's no up and down anymore. There's no circular. It's more you angle it and you brush it in a 45-degree angle so you can cover most of the tooth, and you're cleaning some of the gum areas too.
Okay. So you want to basically kind of half or whatever over the gum and over the teeth. And
that's correct.
And a 45-degree angle achieves what exactly?
It achieves brushing your teeth and also brushing your gum area too, and cleaning any of plaque or any residue that's at the border or at the line of where your gums and the tooth meet. So you can clean that area better instead of just brushing the teeth, leaving the gums, and not cleaning that area.
So the 45-degree angle maybe allows the what do you call those little the
brush, the bristles. Yeah.
The bristles, it allows them to kind of go in between the teeth and the gum a little bit, because it I see. Okay.
Yes.
All right. Now, should people have soft, or like rather hard toothbrushes? Any take on that one?
I personally recommend, and I tell my patients to use a soft toothbrush, Brussels head, because I notice generally patients who use hard toothbrushes, they generally tend to wear away the teeth, or they kind of cause the gums to recede a little bit, because they think that the harder they brush, the cleaner it is, which generally isn't the case. You just need to spend a little more time brushing it, and you can get the same effect with a soft toothbrush without causing all the damage with a hard toothbrush. Just brushing at least 2 minutes and the right technique, the right angle, and it's a little better for your health.
Okay, all right, interesting. Now, what about the electric toothbrush? Are they really any better than the hand ones, or not really?
I'm a big proponent of electric toothbrush. There's several reasons why. Number one reason why is because it does a lot of the work for you. All you need to do is place the toothbrush head in that area of your mouth, and it brushes for you. You don't need to put a lot of strength, a lot of effort, and you just move it around. Another great thing is it has a 2-minute timer, which is recommended the amount of time you should brush your teeth for. It has 30-second intervals. Most electric toothbrush has that, where it'll tell you to move on to the other side of your mouth. And the great thing also is it helps prevent you from over brushing or brushing too hard, which can cause what we call toothbrush abrasion, or it causes recession of your gums. So it helps that too.
Okay, so good. All right. Now, Dr. Lou, I have about 15 some years ago, I've lived a couple of years in Bombay, India, and almost everybody I knew there used a tongue scraper. Now, I've never used a tongue scraper and even still don't, but I do, since that time, brush my tongue and my gums with the toothbrush. Can you tell us a little bit about, is a tongue scraper a good thing? Is brushing the gums and the tongue an okay substitute or a useless substitute? Tell me.
I believe in brushing the tongue too. I generally recommend patients who are smokers to brush their tongue more, because of when they smoke, they get the nicotine accumulations on the tongue, and there's some cases where they've gotten so much accumulation of the nicotine that it causes them to grow hair. It can lead to what we call hairy tongue. They grow hair on the tongue, believe it or not. So you need to brush the tongue to kind of brush all those, nicotine or any of that, any dirt or anything off of it. So, yeah, your tongue also needs to be clean too.
Okay, well, all right. So, so those Indians are onto something by using a tongue scraper, but a brush does the trick also, you say?
A brush does the trick also. You don't need to brush it too hard, just nice and gently and clean it.
Yeah, even though it does sometimes, kind of provoke me to gag a little bit, but, on an average, it feels kind of like it feels a little better and little, so anyway, because I saw it there and I figured if a billion people, well, I don't know about a billion, but since almost everybody I know in India does it, I figured everyone else does it, and there's a billion. I figured if it's good for something which was a billion people do it, it might as well be okay for me, I figured. So you second that.
I definitely second that. That's definitely something everyone should do. And you're correct. It does cause a little gagging, even myself, but, sometimes you'll get used to it. You get used to it.
Yeah. Well, thank you very much, Dr. Lou. Thank you very much.
Thank you.